Fourth and sixth pharyngeal arch derivatives by ENT student. Muscles of fourth and sixth arches are the muscles derived from fourth arch are cricothyroid, levator villi palatini, and constrictors of pharynx. They are supplied by superior laryngeal nerve. The cricothyroid muscle is the only tensor muscle of the body of the larynx, aiding with phonation. It is innervated by superior laryngeal nerve. Its action tilts the thyroid forward to help tense the vocal cords. It is originated from anterior and lateral cricoid cartilage. Insertion into inferior cornu and lamina of thyroid cartilage. Nerve. It is supplied by external branch of superior laryngeal nerve, and it acts in tension and elongation of the vocal folds. Levator villi palatini. It elevates the soft palate and pulls it backwards. This muscle. It originates in the petrous part of temporal bone, inferior or cartilaginous part of auditory tube. It is inserted into palatine aponeurosis. It is innervated by pharyngeal plexus of cranial nerve. Constrictors of pharynx are superior, middle, and inferior. Superior constrictor originates in pterygoid hamulus, pterygomandibular raphe, and posterior end of mylohyoid line of mandible. It inserts into pharyngeal tubercle on basilar part of occipital bone. It is innervated by pharyngeal plexus of cranial nerve 10. It constricts the upper portion of pharynx during swallowing. Middle constrictor. It originates from stylohyoid ligament, from greater and lesser horns of hyoid bone. It gets inserted into median pharyngeal raphe, blends with superior and inferior pharyngeal constrictors. Innervation. It is innervated by branches of pharyngeal plexus. It constricts the middle portion of pharynx. Inferior constrictor. It has two parts, thyropharyngeal and cricopharyngeal part. Thyropharyngeal part originates from oblique line of thyroid cartilage, and cricopharyngeal part from cricoid cartilage. Insertion. Thyropharyngeal part gets inserted into median pharyngeal raphe, and cricopharyngeal part blends inferiorly with circular esophageal fibers. It is innervated by pharyngeal plexus of cranial nerve 10, but cricopharyngeal part also receives branches from external or recurrent laryngeal branches of vagus nerve. It constricts the lower portion of pharynx. Sixth arch derivative muscles. They are the intrinsic muscles of larynx. They are classified into these categories based on the functions that they perform. But the list of muscles are cricothyroid, posterior cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, thyroarytenoid, transverse and oblique arytenoid. Adductors are out of these muscles, lateral cricoarytenoid and transverse arytenoid muscle. Abductors are posterior cricoarytenoid. Sphincters are transverse arytenoid, oblique arytenoid, and aretoepiglottic muscle. This muscle. And then tensors are cricothyroid muscle, and muscles that relax vocal cords are thyroarytenoid muscle and vocalis muscle. These.